The World Health Organization says the highest ever number of new COVID cases was recorded globally over the past week, more than 5.2 million. Now, look at this chart and you'll see the spike. It shows the 7-day moving average of new cases worldwide. India and Brazil are driving much of the rise. India's reporting nearly 300,000 new cases a day. David Nabarro is the WHO's special envoy on COVID-19. David, it is good to see you. David, I guess there's an impression, particularly for those of us in the United States or in the EU or in developed economies where vaccination is... I mean, I had my second vaccination yesterday. Arm's a bit sore, but everything's good. But the rest of the world is in a very, very, very different situation.
It's super tough. Actually, I look every day at the total number of people with COVID that is reported to the WHO. And actually, over the last 3 months, I've been getting progressively more concerned because what we're seeing, all of us, is a really rapidly accelerating situation. As you say, that the numbers are high at the moment because of real expansion in infections in South Asia and also in Latin America. But just think back to before Christmas, when the numbers were very high, driven by a lot of COVID in the United States, and they were high earlier this year, driven by a lot of COVID in the United Kingdom. And I think this is what we're going to see more and more, is that the virus will move around and surge in different places, and it'll do it at intervals, but it won't be seasonal like flu does, which tends to come in the winter months. This will surge any time, but it's going to go on surging, and I actually think the virus is here to stay, Richard. It's not going to go away.
Okay, so it becomes endemic. And the issue, David, is, look, let's take a surge in the US. A surge in the US would be, or the UK, would be serious, but it wouldn't have anything like the same deadly implications because the majority of those who are at risk, the vulnerable, are vaccinated, and the population will be vaccinated by end of summer. So the death element to this remains still in the developing world when these surges happen.
Now it really has shifted, as you say, to being a developing world issue. But I'm expecting that variants will go on emerging. After all, there's a huge amount of this virus around in the world, and it's mutating constantly. And we get variants being reported continuously. And it's these variants that are the problem, because it's really not at all unlikely, and I want to say it's almost inevitable, that variants will emerge that can evade the protection offered by the current generation of vaccines. So whilst in the US or the UK, people are understandably feeling quite good about the situation, I'm going to say, please don't imagine it's gone away. Otherwise, you'll get caught napping. This virus is very much here to stay, and it's mutating. So the chances of a vaccine-beating mutation in the US, UK are very high. I'm not going to say definite, but I'm going to say very high.
Sure. Now let's listen to the president, because one of the big, until that vaccine-busting mutation takes place, vaccines are the answer. This is the president was the president was just asked whether he would, since there is now a glut apparently of vaccine in the US, would he release some to the developing world? This is what he said.
But there's other countries as well that I'm confident we can help, including in Central America, and but it's in process. We don't have enough to be confident to send it abroad now, but I expect we're going to be able to do that. Thank you.
The ability, I mean, COVAX is doing great work. The other countries, I mean, assuming once J&J and AstraZeneca is up and running fully again, but it's still going, we're talking months, if not several years.
Yes. Yes. Do you know the current rate of immunization in the world is 16 million doses a day, plus or minus. To immunize the world at 16 million doses a day would take 2 more years at least. So with the present implementation of vaccination, with the present supplies, we've got a long haul, and there's plenty of time for these horrible variants to come along and cause trouble. So the only solution is to increase the amount of vaccine that's available. And I'm really strongly focused on anything we can possibly do to get an increase, and that's where the United States is hugely important. If the US says we'll do everything possible to get vaccines everywhere, then you can be absolutely certain that the rest of the world will find a way to follow suit. I'm super pleased to hear President Biden saying that he is, at the moment at least, disposed to think about leading on giving vaccines to other countries. So let's see the leadership go up a few more notches, because actually this is a global problem. And without US leadership, alongside the rest of the G7 and the rest of the G20, but without that, this is going to be a tough one, you know, Richard.
David, it is always a privilege to have you talking to us on Quest Means Business. I'm grateful. Thank you, sir.
Thank you. Bye-bye.